My name is Ted Manson, and I'm a joint replacement specialist at Towson Orthopaedics in Baltimore. I originally got into orthopedics through engineering. I was an engineer after college and was working with implant design and orthopedics and decided I was more interested in the surgical aspect of things. I did my orthopedic residency at Johns Hopkins back home here in Baltimore, and then did a trauma fellowship at the Shock Trauma Center in Baltimore in orthopedic trauma surgery. Then went to New York for an additional year of training in joint replacement at the Hospital for Special Surgery. When I got back to Baltimore for about 10 years, I worked at Shock Trauma as a trauma surgeon full-time, but then I also had an elective hip and knee replacement practice. And then in 2019, I moved over to doing pretty much exclusively hip and knee replacements. So for many years, I've done patients who have relatively straightforward problems, including arthritis of the knee and the hip, but then also some of the more complex cases such as knee and hip arthritis after previous broken bones with plates and screws and rods in place, or patients who have severe failure of the hip replacement with large amounts of bone loss or severe infections that really compromise our ability to put in new implants. So what I really like about orthopedics is the ability to watch patients who come in pretty significantly disabled and then see how they're walking when they come back to the clinic. For me, that's the most rewarding thing. So what drew me to Towson Orthopaedic Associates originally was the surgical skill of the surgeons that we have here at TOA. There isn't one person here that I wouldn't send my family to for surgery, and all of the physicians are highly specialized, so they really focus on the areas that you're coming to them to see, and that helps, as we know, the more that you do of anything, the better that you are.